Hello guys, this is Alex and my case presentation is on disseminated intravascular coagulation, but it can also just be called DIC. And the typical patient presentation for disseminated intravascular coagulation is an elderly female hospitalized for respiratory distress due to pneumonia, develops sepsis, and is admitted to the ICU. She has hypotension, tachycardia, and a fever. Nurses noticed hematuria, petechia, and blood-tinged secretions. Lab results showed a positive D-dimer, prolonged PT, and a PTT, and a platelet count of 75,000. The etiology of disseminated intravascular coagulation is the abnormal blood clotting throughout the body, secondary to a significant disease. Shown in the picture is the scale where the forming clots is basically outweighing breaking down the clot. This causes widespread clotting throughout the blood vessels in the body and can cause organ ischemia, and it can also lead to the depletion of clotting factors, which may lead to bleeding. Some background information of DIC is that it was known throughout medical history due to medical literature written about it for centuries of its presence found with other diseases. It was not accurately described and made officially into its own disease until the 20th century. Because it is found with many underlying diseases, it is found in 1% of all hospitalized patients. It is found more commonly with sepsis patients, with 18.1% of the ICU patients having DIC, and 16.9% among severe trauma patients in the ED or ICU. The risk factors for DIC is that it is usually characterized by males and aging, but DIC is a secondary disease, so the biggest risk factors is to have an underlying disease, such as sepsis, which is when inflammation diffusely activates the coagulation system, consuming multiple clotting factors and resulting in DIC. Cancer often leads to the activation of coagulation, manifesting as disseminated intravascular coagulation in its most extreme form. DIC is also characterized by systemic intravascular coagulation activation, leading to deposition of intravascular platelets and fibrin and simultaneous consumption of coagulation proteins and thrombocytes, which may cause bleeding complications. DIC can be brought about by a number of obstetric complications, including acute peripartum hemorrhage, placental abruption, and other issues that may lead to maternal death. Endotoxins are lipopolysaccharides found in the cell wall of gram-negative bacteria, which can induce inflammation and fever as an immune response, which can also lead to DIC. The more official pathophysiology of disseminated intravascular coagulation is usually resulted from the following four simultaneously occurring mechanisms. First is the tissue factor, which is mediated through thrombin generation. Second is the dysfunctional physiological anticoagulant mechanisms, which cannot adequately balance this thrombin generation. Third is the impaired fibrin removal due to depression of the fibrinolytic system. This is mainly caused by high circulating levels of plasminogen activator inhibitor type 1. However, in exceptional forms of DIC, fibrinolytical activity may be increased and contribute to bleeding. And the final and fourth contributing factor is inflammatory activation. To understand the process of DIC, it may help to understand the normal function of blood clotting in our bodies. The body responds to damage of blood vessels, such as an opening, by closing up the damage through primary hemostasis, which involves blood coagulation. This is the process of blood changing from a liquid to a solid state, which gathers at the site of damage so it can prevent bleeding. Coagulation cascade follows the primary hemostasis step as the clotting factor in which proteins and fibrinogen are made into fibrin, which makes an even stronger clot to close up the injury. Fibrinolysis is the last step, when the clots are broken down to prevent any unnecessary clotting of the blood vessel. Now that we know the normal function of the blood clotting system, it is a lot easier for us to understand how disseminated intravascular coagulation can affect our bodies. It usually starts with an underlying disease releasing procoagulants, which increases the formation of clots as opposed to fibrinolysis. DIC uses up these platelets and clotting factors, which forms clots throughout the blood vessels, as shown in the blood vessel on the top. As you can see, there are many clots throughout the blood vessels, and because fibrinolysis is impaired, they are unable to get rid of these clots, and it may lead to organ ischemia. In the bottom blood vessel, it shows that there are damages and injuries to the blood vessels, but there are no more clotting factors and platelets because it was used up from other areas of the body, and the body is unable to repair these injuries due to DIC. Some of the symptoms of DIC are bleeding due to the lack of clotting factors in some of the blood vessels, blood clots caused by the inability for fibrinolysis to occur to break down the clots in the blood vessels. It can also cause hypotension, where the TF8A complex activates thrombin, which cleaves fibrinogen to fibrin while simultaneously causing platelet aggregation. The intrinsic or contact pathway may also be activated in DIC, though contributing more to hemodynamic instability, which ends up with hypotension. Due to the multiple clots and open scars throughout the arteries, DIC can also attribute to hypoxemia. The damage to the regular blood clotting systems also show symptoms of fever, bruising on the peripheries, as shown in the pictures with the red spots, and confusion, loss of memory, and even change of behavior due to the lack of oxygen going into our brain. Diagnosis of DIC is done mainly with blood tests, such as the complete blood count with blood smear exam, which measures blood count, including platelets. Results can show increased or decreased amounts of platelets to signify DIC. Partial thromboplastin time, or PTT, is a blood test that times how long it takes for your blood to clot. Prothrombin time is a blood test that measures the time it takes for the liquid portion or plasma of your blood to clot. Fibrinogen blood test measures the fibrinogen found in the blood. The D-dimer blood test is done to check for clotting issues, which is usually used to see if treatments for DIC are working or not. There is no specific treatment for DIC because it is a secondary disease. The goal for treatment is to determine and treat the underlying cause of DIC. There are supportive treatments such as plasma transfusions, which replaces blood clotting factors if a large amount of bleeding is occurring. Blood thinner medicine, such as heparin, to prevent blood clotting if a large amount of clotting is occurring. Here are my sources for the case presentation, and thank you for listening to my case presentation. on disseminated intravascular coagulation.